Public figures often appear on television as though everything in their lives is perfectly organized. But behind the scenes they experience the same worries, decisions, and health concerns that many people face. Recently, Mark Consuelos shared a personal story that resonated with viewers because it combined humor, honesty, and an important message about health awareness. What initially appeared to be a simple absence from television turned into an opportunity for a broader conversation about preventative care, overcoming hesitation, and taking responsibility for personal well-being. Through a candid discussion alongside Ripa, Mark transformed a private experience into a relatable story that encouraged audiences to pay closer attention to their health while also finding humor in everyday life. An unexpected absence sparks curiosity. When Mark Consuelos was missing from several broadcasts, many viewers naturally became curious. Television audiences grow accustomed to seeing familiar personalities on a regular basis, so any unexpected absence often generates questions. Without an immediate explanation, speculation began to circulate among viewers, wondering whether he was working on a new project, taking personal time, or simply dealing with a private matter. Ripa continued hosting with guest co-hosts, maintaining the show's usual energy while audiences waited for answers. Once Mark returned, however, it became clear that the reason behind his absence was far more relatable than many people expected. Rather than involving professional changes or dramatic circumstances, his time away centered on something many individuals postpone, despite knowing its importance. His decision to speak openly about the experience helped transform curiosity into an educational conversation. Viewers appreciated the transparency because it addressed a topic that affects countless families and individuals across different age groups, opening up about personal health. Upon returning to the program, Mark chose to discuss a health-related experience that many people find uncomfortable to talk about publicly. His openness immediately resonated with viewers because it reflected a challenge that countless adults face. Health screenings are often recommended by medical professionals, yet many people delay scheduling appointments due to anxiety, uncertainty, or busy lifestyles. Mark admitted that he had postponed an important preventive screening longer than recommended. Rather than hiding that fact, he acknowledged it openly, helping normalize conversations about health maintenance. His willingness to share his experience served as a reminder that even successful and confident individuals can struggle with medical apprehension. By discussing his decision publicly, he encouraged others to reflect on their own healthcare habits. The conversation moved beyond personal storytelling and became a broader reminder about the value of early detection, routine checkups, and taking proactive steps toward maintaining long-term wellness and overall quality of life. Understanding the fear of finding out. One of the most meaningful parts of the discussion centered around a concept known as the fear of finding out. This idea refers to the tendency to avoid medical evaluations because of anxiety about potential results. Many people understand this feeling. The uncertainty surrounding health tests can sometimes seem more frightening than the procedure itself. As a result, individuals postpone appointments and delay important conversations with healthcare providers. During the discussion, Kelly highlighted how avoidance can sometimes allow manageable concerns to develop into larger issues. Mark's story illustrated how common this mindset can be, even among people with access to excellent healthcare resources. By addressing the topic openly, the conversation helped reduce some of the stigma surrounding medical anxiety. It also encouraged viewers to recognize that fear is a natural emotion but should not become a barrier to self-care. Awareness, information, and professional guidance remain valuable tools in maintaining physical well-being and peace of mind. Turning a private experience into public awareness. What made Mark's story particularly impactful was his willingness to transform a personal experience into an opportunity for public education. Discussions about health screenings often remain private, leaving many people uncertain about what to expect. By sharing details of his journey, he helped demystify the process and make it feel more approachable. Viewers heard firsthand that the experience was manageable and far less intimidating than they may have imagined. Public figures have a unique ability to influence conversations, and Mark used his platform in a constructive way. Rather than focusing solely on himself, he emphasized lessons that could benefit others. The discussion reinforced the importance of preventive healthcare, while reminding audiences that seeking medical advice is a sign of responsibility rather than weakness. This type of openness can encourage people to schedule appointments they have been postponing and feel more comfortable discussing health concerns with family members and healthcare professionals. Humor in unexpected moments. While the conversation began with serious health themes, it also included light-hearted moments that reflected the couple's well-known sense of humor. Mark described feeling relaxed and well-rested following his procedure, leading to amusing reflections about his recovery experience. Humor often plays an important role in making difficult or uncomfortable topics more approachable. By sharing a funny story related to his recovery, he helped create a balanced discussion that combined valuable information with entertainment. The audience responded positively because the humor felt natural and relatable rather than forced. Life's unexpected moments often become memorable because they blend seriousness with laughter. Mark's storytelling demonstrated how people can maintain perspective during unfamiliar experiences by finding small moments of joy. This balance allowed the conversation to remain engaging while still delivering an important message. It also highlighted how humor can serve as a powerful tool for reducing anxiety and making challenging topics easier to discuss openly. The dynamic between Kelly and Mark. One reason the story resonated so strongly with audiences was the authentic dynamic between Kelly Ripa and Mark Consuelos. Their conversations often feel less like formal interviews and more like genuine exchanges between partners who know each other well. Throughout the discussion, Kelly provided additional perspective, sharing observations and playful commentary that complemented Mark's storytelling. Their natural chemistry created an atmosphere where viewers felt included in the conversation rather than simply observing it. This authenticity has long been one of the defining characteristics of their partnership. Whether discussing family life, personal experiences, or everyday challenges, they bring honesty and warmth to their interactions. In this case, their ability to blend humor with meaningful discussion helped make a potentially uncomfortable topic accessible and engaging. The conversation served as another example of how genuine communication can create stronger connections between public personalities and the audiences who follow them. The importance of preventive care. Beyond the humor and storytelling, the central message remained clear: preventive healthcare matters. Medical professionals consistently emphasize the value of regular screenings because they can identify concerns before symptoms become serious. Yet many people continue postponing appointments due to fear, inconvenience, or uncertainty. Mark's experience served as a reminder that taking action is often easier and less stressful than imagined. Preventive care represents one of the most effective ways individuals can protect their long-term health. Early detection often creates more options and better outcomes while providing reassurance when results are normal. By discussing his experience openly, Mark helped encourage a more positive perspective on routine healthcare. The conversation reminded viewers that investing time in wellness today can help prevent larger challenges tomorrow. It also reinforced the importance of listening to medical guidance and prioritizing health regardless of how busy life becomes. A relatable story with a meaningful lesson. At its core, this story was about much more than a temporary absence from television. It became a conversation about responsibility, self-awareness, family, and the importance of facing concerns rather than avoiding them. Mark Consuelos transformed a routine health experience into a relatable lesson that resonated with many viewers. His honesty helped normalize discussions about preventive care, while his humor made the topic feel less intimidating. Together, he and Kelly created a conversation that was informative, entertaining, and genuinely human. Their willingness to share personal experiences demonstrated how public figures can use their platforms to encourage positive actions without sacrificing authenticity. Ultimately, the story serves as a reminder that taking care of one's health is an act of self-respect and responsibility. Through openness, humor, and honesty, Mark delivered a message that extended far beyond television and into the everyday lives of the people watching at home.